Great. Well, thank you, everybody. Thanks for joining us on our Zoom call for our board meeting. Appreciate everybody's time. We will try and be as expeditious as possible. But meeting is called to order. And Jeff, I don't think we need to take the roll because everybody is identified, correct?
That's correct.
Okay. So I would like to dispense with the reading of the minutes unless there are any additions, deletions, or corrections. Are there any? Seeing none, we will accept the minutes as presented and go right to the budget, and I will suggest to everybody that we'll take as much time as we need to do this. As John will report, the budget has in some form been reviewed by both the Finance Committee and the Executive Committee. And I would hope at the end of John's presentation to have a motion to accept the budget after questions and go from there. But that is the acceptance of our budget today is the single most important piece of business that we have. So with that, Tom and or John, or Tom, you want to talk about the process a little bit, some of the assumptions, and then we'll go right with John's explanation.
Sounds good. John's going to put up the management summary. Before we do that, I also want to say that the Finance Committee recommended for approval of the budget. So after the presentation, Mike, if you want to add some comments, I'd be good to do that. So management summary, just real quick at a very high level. I'm not going to read through all these. Obviously, we're dealing with a pandemic still. We know that it's going to take some time for us to recover from the losses and the additional costs in the next year. And John's going to kind of go through a little bit of where we started this year with. But overall, our goal was to make sure that we watch cash into 2021. We knew that we were going to have to take a significant loss, but reduce that loss. And one of our other goals was to continue to maintain the workforce as best as we could, to make sure that we have care by the bedside, and in addition, make sure that we do not have any set amount of layoffs, because we already went through that this year when we reduced 70 positions as well as the furloughs. So our goal is to manage our workforce number through vacancies and really be stringent upon not refilling jobs. Doesn't mean there won't be restructurings of departments or different areas. It may result in a job loss, but overall, that we're not looking at any sort of significant layoff plan for 2021. So just before I start, very proud of the team. They've done an unbelievable job of looking at non-personnel expense items as well as personnel expense items to see where we can save dollars and efficiencies. So just want to give a shout out to the executive leadership team. They just did a phenomenal job this year. So with that, I'll turn it over to John.
And Tom, it's John. Just before John speaks, I don't want it to be lost on the board that our primary function or primary goal in the review of the budget was the maintenance of our patient care. And that was what the resistance to doing any layoffs was. So I would echo Tom's appreciation for what Andy and John and Dr. Murray and everybody, Karen, everybody has done to be sure that at the bedside, for what we do and consistent with our mission, even though the budget is not going to be wonderful, it's going to be as best we can do while maintaining the care level that we've all become used to. So thank you, Tom. Thank you, John, for being sure that got done. So I wanted to say that so that the board understands the primary motivator or driver in some of the decision making that we made relative to the actual numbers. So John, if you would, please.
Sure. Good afternoon. And I think Tom and John have kind of given you the intro and set it up pretty well. What I did want to just highlight on this slide before we jump into it, and we'll start with the end in mind, and that's that you know, we've talked a lot about the challenges that we're facing this year and what's going to be continuing into 2021. And we wanted to really do that, you know, without sacrificing quality, to John's point. We believe we've been able to do that with this proposed budget. It does reflect an operating loss of about 29 million. So we've taken a measured long-term approach to recovery. And in order to achieve the goals that Tom had identified here on this slide, we ended at around a $29 million operating. But before we jump into the assumptions, I think it's important to note that our process here and the package that had been uploaded to the portal, which is the full regulatory package, as well as that same package that was reviewed in detail with the Finance Committee this morning, meet all of our regulatory requirements. And as we go forward into today's meeting and then subsequent to today when we upload it to the New York State reporting system, that will then finalize our requirements as we get through that process. It's been prepared really consistently with how we've done it in past years. As Tom mentioned, the executive leadership team, because this year was somewhat of a unique year in terms of timing and how we started the process and then still having the same end date, we really had to push through as a team to get down into the detail quickly and make sure that we were addressing anything that we had to achieve the goals that Tom identified. So wanted to thank the leadership team, very engaged, very involved in the entire process, as well as the management folks that we've engaged throughout this process as well. Couldn't really have done it without the whole team. So one other item I just wanted to really highlight on our process is that normally in a budget year, we would take our current year and run that out and then look at that as a baseline. This year, because of the uniqueness of COVID and what's happened, we really wanted to take what the latest information was, but also layer on top of that a more stable year. And so as we built the baseline for the 2021 plan, we did build that upon both 2019 as a full year, but also 2020 and that activity prior to COVID. Just trying to make sure that, you know, we're catching everything, really trying to understand what a stable year would look like given what we're seeing in 2020. And you'll see that in some of the variances that we'll show in a few slides. Obviously, we'll go through the rest of the process, but as Tom mentioned, the Finance Committee, we reviewed in detail the budget this morning, who also, you know, have recommended approval at this point. But I think it's important now to really jump into how we got to the 29 million. It's an unusual year. It's uncomfortable for many of us to budget a loss. It's not something that we normally would be setting out to do in the beginning of a process. The realities of it are such that you know, we had to really go through that process and understand from a realistic perspective, but also how we achieve the same end goals that we set out in the beginning. So I'd like to kind of take you through some of the specifics. The ratios are really just the end result of the things we'll talk about. They're in your detailed package. Happy to answer any questions at the end on any of these, but we're going to touch on several of these as we go through the presentation. But it's really important to start and look at it as a trend and how we built the budget and what it really looks like with 2019 and what we're looking at for 2020. We have a projection in here for 2020. We've talked about this in previous discussions. This is consistent with those discussions. Our goal for 2021, as Tom mentioned, was really to reduce operating loss from 2020. Now, this is a snapshot in time, so our current projection could and likely will change just based on the ever-changing environment that we're living in. But as of today, given the CARES Act funding that we know of and the run out of current operations, we still anticipate a loss of roughly 41 million. with an improvement of the 21 budget to close to 29, a little over 29 million. That 2020 projection, as I said, will change. There are things that are moving parts that we'll talk a little bit more about later. One is the pension expense, but also just the uncertainty around the state and federal budgets at this point in time. And I think, from a process perspective, as before we get into the assumptions, it's important to note that when we started the process and getting into 2021, we were faced with financial realities that we oftentimes haven't in the past been really faced with. COVID expenses are one that we've talked about, and those will continue. Many of those will continue. We'll talk about that as well. We have roughly $11 million of additional expense in our operating plan for 2021. But that, along with the discontinuation of and the expiration of the 2 grant programs we had been operating within over the last several years, and those would be the district program and the CREPS program at this point. Both had expired as of March 31st, 2020. So that, combined with other inflation and additional increases in need for COVID-related preparedness, we were faced with an uphill battle going into this. So when we went into our assumption building and trying to really understand what we needed to do, our largest driver of our performance is really our volume. And so in looking at the volume, what we wanted to make sure of was that we weren't really taking 2020 that you see on the screen here in the projection column and using that truly as a baseline, because it really is a depressed look and a depressed snapshot of the current volume and what a stable year might look like. So we really took a step back and tried to focus in on what a stable year would look like. So 2019 in these comparisons is really how we've crafted the budget. So when you do look at these variances, while they're increasing significantly from 2020, they're really relatively stable with slight declines in certain areas from 2019. And those declines that we're seeing, as an example, in outpatient, in the clinics, in certain areas, including chemical dependency, but in the therapies, we're seeing those declines from 19 as a result of COVID. So where we have group sessions, the groups have to be smaller. Those regulations haven't yet changed back to pre-COVID levels. So there are certain specific areas that we wanted to make sure of that we took into consideration. One other item that I'll note here before I move on to the rest of the revenue assumptions is that length of stay is an important driver for us. It's been really an area that has been increased in the tail end of 19 into early 2020. Our team, under Karen's leadership and Andy's leadership, have really worked to get that down. We've budgeted a length of stay that's less than what we're currently running, or at least what we were projecting to run in 2020. It's more in line with 2019. But I will say that this is already where we're running today, and in August, September year to date, and in August is at or below what we're budgeting for next year. So we're real happy with the progress that's been made there. Lastly, on this slide, and then I'll shift forward, is you do see an increase in the emergency visits. That's indicative of all of the work and effort and investment that you all have made in the emergency room, as well as the great care that's being provided there. So we are anticipating a higher number of visits, and from those visits, we are anticipating additional admissions as a result. But the other revenue increases that I thought I'd highlight for you today are just, many of these are typically what you would see and what we have built into our operating plans in the past. And so we look at the payer rate increase. That's really a composite increase of all of our payers. That's a little higher than it was in prior years, but nothing really inconsistent there. And that's, again, before any additional cuts that we might be seeing from Medicare or Medicaid, and especially those that we already know are coming. We have had some changes within our operations within several of our areas, including the opening of our ICU, medical ICU, as well as the expansion of what was formerly our observation unit in 8 Zone 3 from 10 to 20 beds, but also looking at a really efficient and effective reuse of our old emergency department into a dedicated observation unit, with the plan to expand that to 16 beds, which really is the right way to do that in the right setting adjacent to the emergency room to really work on figuring out whether or not those patients really need to be admitted. It's the most efficient and effective way. I already spoke about a couple of the outpatient volume declines, but revenue cycle has been an area of improvement opportunity that has been mentioned in prior board meetings. It was also included in this past year's operating plan. This year we've included several improvement areas as well in enhanced revenue related to clinical documentation improvement, professional billing, bad debt expense, but denials I think are one area that we've continued to talk about, and we've put processes in place to capture additional revenue related to these denials, and it's really surrounded around payer governance and accountability, and so we're really looking at a huge focus there because we understand that revenue drives the rest of the organization and drives the rest of the assumptions as we go forward in our conversation today. We believe it's reachable and achievable, the additional revenue that we've included in that area, and it's going to allow us to, as Tom said, manage our expenses through different ways. And I'll come back to the FTEs that we spoke of earlier in the vacancy management, but you'll see here that we have our typical inflationary type increases. We have on average 3% for contracted union wage and step adjustments, and then our non-contracted staff at roughly 2%. But we're also seeing COVID-related increases in staffing, of course, but also in health insurance claims and workers' compensation benefits, in potential unemployment estimates, but also in insurances. That industry is really feeling the pinch from the pandemic as well. And then we've right now included our pension expense and post-retiree health at the current rate, although things are rapidly potentially going to change in those areas just given when those are valued. And so our focus, as Tom mentioned, first always is non-labor. And so when we refer to non-labor, we look at any non-salaried areas. So we do have physicians on staff, but we also have many that are contracted. And so we do look at improving the economics around our expense as it relates to our physicians and residents. We've been able to do that this year without sacrificing patient care and without sacrificing in terms of numbers, the number of physicians that we have. We've also really taken a hard look this year, as you would imagine, at our contractual fees or purchase services, to use another term. This is really indicative of the non-labor pool of expenses outside of supplies that we've tried to monitor, but really took a hard look at this year to reduce, and that's in consulting costs, purchase service contracts as well. So we do buy a lot of outside service. Any areas where we've tried in the past or had to incur outside costs in either on a temporary basis or a longer term basis, we've really tried to step back from those and look at them and try to understand why we're buying it from the outside. Can we do it with the staff we have, or a complement of new staff, just to make sure that we're using our resources most effectively and efficiently. I think from a supply perspective for us, it's really being driven this year by COVID costs. So we've talked a lot about it. We've continued to capture those COVID-related costs for the board as we've reported out to you on a regular basis. these costs are increasing. We have 90-day supply inventory mandates. There is a supply and demand economic problem that's occurring within the PPE world, and so that is happening, continues to happen. Inflation on those items is quite significant and continues to be significant just based on the availability of the required PPE for all of the hospitals in the country. Lab testing supplies, that's something that is not going away, so we've built in costs related to that. And then I've already talked about inflation, but we have our normal inflation on everything else, so pharmacy and our other supplies. And we've really tried to take a look at offsetting those increases with targeted savings initiatives. And those are things that we are typically trying to do with partners within Great Lakes Health, but also for ourselves, where we have opportunity to reduce cost, to work with our physicians on what they're using, how they're using it, and in a way that could possibly save dollars for the organization. So we continue to do that, and we've been able to offset other inflation with those savings initiatives going into next year. As we've built out around us, whether it's our emergency department, the windows project that is ongoing at this point, the lobby renovation that I know seems like forever ago that we stood together in the lobby and christened that space, but all of those capital projects will and have resulted in additional capital costs for us, and by that I mean really depreciation and interest going into next year. In order to really accomplish the budget, I touched on several of our performance improvement opportunities, some of which are an evolution of items that you would recognize from last year's report. The first being accelerating excellence. So from last year to this year, the evolution of that program is really taking it to the next level of how we can continue to become more efficient and more effective at what we do in order to move patients through the building, to start surgeries on time, to reduce supply costs, to improve revenue cycle. All of those things continue to evolve on the planning board for us and are built within our operating plan. I talked a little bit about the insurance plans and our payer relationships. This is an important component of what we're trying to do this year, although not all of our relationships are out of contract this year, but we do have the opportunity to work more closely with our payer partners on governance and how we're working together, especially around denials. So that's going to be key. But lastly, on this slide, I won't go through all of them, is really the vacancy management. And so Tom mentioned that, and we'll talk a little bit more about it when we finish up. But from our perspective, we're really looking at total FTEs, and I'm going to go back 2 slides just to show you the numbers. So when we looked at our overall FTE complement when we started this process, we had anticipated to be around 3,592. It's not reflected on this slide, but that's where we started our process. And in going through the rest of our budgeting, we had really calculated a number of about 3,462, which is roughly 130 FTEs lower than the 3,592. And the way we wanted to accomplish that without taking significant job action was to go through and manage all of our vacancy opportunities. We have many vacancies that come up on a regular basis, whether it's through retirements or just our standard turnover, which averages around 9%, that we have the opportunity to manage our FTEs in that way. And as you can see, we did that. We started this process to talk about this in July, but even through the month of August, and even through this last pay period, as Andy and I were talking today, we've already started that. And so what was 3,592 is now 3,574. So we've already begun to manage those vacancies appropriately down to those levels. And this will be a continuous process. It will be challenging, but it's necessary to make sure that we accomplish our stated goal. Tom, Andy, I don't know if there's anything else you wanted to mention on that.
Nope, you covered it.
Okay. So every operating plan is not without its emerging issues and risk areas, and wanted to make sure, from a regulatory perspective, we wanted to outline these, but there are several on here, but really the most significant of the items are really the first two bullets, and that's our uncertainty and what feels like continuing uncertainty around what's happening in New York State at the Medicaid and the budget level, but also at the federal level and what will happen in the future. New York State continues to report a budget gap this year of roughly $14 billion, which also continues into next fiscal year, something a little bit higher than that, and even into the out years, absent any additional relief. So it really is truly an uncertain situation, and at this point, we've basically included in our budget the cuts that we're aware of, but we just don't know what the extent of any future cuts may be. And so the other component obviously is COVID-19. That for us is an uncertainty, and so we've prepared and we've built into our plans preparedness costs, whether it's PPE, staffing, cleaning the organization and the facility, looking at and making sure we have screeners and all of our access points covered, making sure we have capacity or the ability to get capacity quickly if we needed it in a surge plan. All of those things have been built in, but there is still uncertainty around what could happen, what will happen, and so we've done our best at that. And so the rest are items that are typically, you'll typically see. I think pension expense is the other that I've talked about, and when I talk about August's results, we'll talk a little bit more about that. But as of right now, we've included what we currently expend in pension. And obviously, as we talk about a $29 million loss, as well as in prior meetings, we've talked about the cash position of the organization being a key component of what we're monitoring on a near weekly basis, just to make sure we're able to do all of the things that we needed to do. The impact of all of what we've talked about, and then ultimately having to pay back our Medicare loan, which we've discussed, will certainly impact our ability to fund future capital to the levels that we may have seen in the past, at least in the short term. And so what we've done in the next year, as well as in planning for 2022, is reduce our routine capital.
I'm actually in the meeting, but
We've reduced our routine.
Just a reminder to folks, put your phones on mute. There's a little background noise.
So we've reduced the routine capital spend to $5 million. We do anticipate continuing the two construction projects that you had previously approved, one of which the first $10 million from the bond funds would be for the Windows project, and the second $10 million from internal funds would be for the beginning of the first phase of our MEP, which is the mechanical, electrical, and plumbing project. So that those two would still be continued. On the routine capital side, though, it's important to note that this typically over the last couple of years has been roughly 15 million, so 1.5, in order to make sure we are meeting that we have the ability to comply with our debt covenant and the goals that Tom outlined. We had to reduce that. I will say, though, that in 2020, we're roughly spending around $10 million of capital. And then, as we've discussed previously, as we look out into future years, we'd be looking to increase that if possible. And so I'm going to stop there. That's the really, the executive summary of what was presented and proposed to the Finance Committee this morning. So I'll stop there, see if anyone has questions, or if Tom or Andy wanted to say anything else that I might have missed.
Oh, I think you covered it all, John.
Thanks.
Thank you, John. Further questions? Comments?
No,
Okay, well, I'm sorry.
sorry, I just
Please.
thought I'd mention one of the discussions that we talked about this morning in finance, that obviously seeing a loss of 50 million in cash is not ideal. And I just wanted to mention that John did mention that he's looking into any other stopgap measures or short-term financing type options, just to be prepared should we need it. That's all.
Thank you. Any other comments or questions? So the budget has been presented. I'd be happy to take a motion now to approve it as presented by our senior management team. Is there such a motion?
Hi, it's Jen Persico. I'd be happy to make that motion.
Thank you, Jen. Is there a second?
I'll second it, John.
And just John,
Thank
for the record, just to make sure we're clear so the board knows what they're approving both the 2021 operating and capital budget for the corporation.
Thanks, Tom.
Yep.
Motion's been made and seconded. Further conversation, further discussion? If there's none, we'll come to a vote. Please signify by saying aye and or raising your hand for the Zoom if you are voting to say yes. All in favor, please say aye and yes.
Aye.
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 And the contrary. Thank you. Let the record show that the budget has been approved and both the operating and capital budget were approved unanimously. Thank you, everybody. John, thank you, and Tom and Andy, per usual, well done. Let's go right on to the resolutions. And Tom, I'm going to ask you for your help here because I don't have them in front of me. So
understood, John. We just approved the 2021 operating and capital budget. And again, thank you to everyone for your support, and thank you to Mike Seaman and Finance Committee for your thorough review of our budget process. John, the next resolution is for approval of certain funding from the Office of Mental Health.
Yes, so just real quick, this is on an annual basis. Occasionally the Office of Mental Health provides additional funding in our rates for not-for-profits who take care of mental health and behavioral health patients. And those dollars that they funded to us, we're required to attest that they are being utilized to pay salaries of those caregivers. And so we've done that. We have used those funds. So this resolution basically resolves that we have used approximately $244,000 of funding in 2020 and added those to rates to the appropriate caregivers.
Okay. Maker of the motion, is there a second?
Hi, it's Jen. I'll second.
Any further conversation? All in favor, please signify by saying aye.
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 And opposed.
Okay.
That motion carries as well. Thanks, everybody. Are there
Thank
any
you,
other
John.
motions, Tom?
Yeah, the next resolution is for Dr. Flynn for medical dental staff minutes, and then we also have a separate vote that Dr. Murray will present for a appointment of a chief of service and associate chief of service.
So we've got two resolutions?
Yes, correct. So I'll let Dr. Flynn do the medical dental staff minutes first.
Yes, thank you, Dr. Quattrochi. I would present for your consideration the credentials from or the minutes from the Credentials Committee of September 3rd. It is being presented ahead of the MEC review of 9/28. There were, yes, there were.
Bill, I would just comment that Because there was no board meeting last month, we've also attached the credentials minutes from August, which also need to be approved as well as this month's.
Thank you, Dr. Murray. To summarize the September meeting, however, there were 9 initial appointments, 4 temporary appointments, 1 unaccredited fellowship in neurosurgery, 25 reappointments, and 11 resignations from the staff. 2 people moved from the active staff to courtesy refer and follow. And that concludes the minutes from the Credentials Committee meeting of September 3rd. Thank you.
Thanks, Dr. Flynn. Dr. Murray or Dr. Flynn, you want to talk about August or just include them as part of this resolution?
I would include them as, yes. Sorry, Brian.
Yeah, I can talk briefly because there were 10 new appointments in August. They were principally in internal medicine, family medicine, and emergency medicine, as well as orthopedic surgery and radiology. There were 15 resignations. The only significant, a significant one or noted one was Dr. Syed, who has been an anesthesiologist here for a number of years, but no other significant issues to report.
Okay, thank you, Dr. Murray. So for the board's review then, we are going to approve the credentials for both September, the minutes for both September and August. Dr. Flynn has made a motion. Is there a second?
Second.
There's a second. Any further discussion? All in favor, please signify by saying aye.
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 And to the contrary? Thank you. That motion carries as well. Any other resolutions, Tom?
Yes, I do have one,
I'm
John.
sorry. One more, yes.
Yeah. The beginning of September, actually, I was approached by Dr. Sean Canty, who's the chief of anesthesia, and he requested that he be allowed to step down from that position. Sean has did really great work, particularly during COVID, where he led a couple of key initiatives with regard to setting up an intubation team and also guided a protocol for tracheostomy. However, I guess it took a little bit of a toll. He has a very young family, and he said he was finding the pressures of the job were encroaching on his family life, and he asked to step down. He did make some recommendations for a successor, and I'm very pleased Tony or Andy and Jim Turner and myself are pleased to propose to the board the appointment of Anthony DePlato as the new chief of anesthesiology. Anthony is a graduate of UB Medical School. He also completed his anesthesia residency here in Buffalo with UB, and on completion of that, he joined our anesthesia staff. So he has been working here for six years, and most recently, he has served as the associate chief under Dr. Canty. So the full slate, the way we do this is we present the full slate of chiefs. Those are on pages 133 and 134, but the only change is in anesthesiology to the slate that was approved by this board in January.
So this resolution is specifically about this one.
Yeah, the chief of
anesthesiology. Chief of anesthesiology. Okay, motion's been made. Is there a second?
This is Sharon. I'll second it.
Thank you, Sharon. Further discussion? Any questions for Dr. Murray and/or Dr. Flynn? Seeing none, please, all in favor of the motion as presented, signify by saying aye.
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 And opposed. That motion carries, and congratulations.
Thank you very much. Appreciate the board's support.
Thank you, Dr. Murray. Thank you, Dr. Flynn.
Thank you, Mr. President.
Other other resolutions, Tom?
Nope, that's it. Just right into reports if you'd like.
Well, we've all been waiting with great expectations for the president.
I'll be sure to make it as quick as possible.
For the president's report, I should remind everybody that we are going to do a brief executive session after Tom's report. So, Tom, please, if you would.
Okay, just before I start, I just want to let the board know I've been texting Mike Seaman back and forth. He was trying to get his phone off on mute during the budget and finance report, wasn't able to do so. So he's going to try to call back in, I think. All right, let me just see if I can do this. It's not letting me control it, John. There we go. All right. Okay, just very quickly. Just a snapshot of where we are with COVID patients. We have 279 COVID patients total that we've treated so far with an average length of stay of 15 days. Currently in-house today, we have 8 COVID patients, 1 of whom is vented, 0 patients under investigation, and negative tests to date is 50,266 that ECMC has conducted. We're continuing our journey to zero harm. This is just a representation of things that we're putting up around the hospital to make sure that we emphasize safety across the hospital and obviously celebrate our Leapfrog A score. So when you have the opportunity to come in the hospital, you will see these inside the elevators. Peter's done a nice job of getting these images around the hospital. Quality, January and July, we had a few more Caudy and CLABSI cases, frankly, than we would like, but around central line infections, obviously with COVID patients, central line, we've had obviously a lot of patients who have been vented, and we had 6, 3 of whom were COVID positive. So continuing to monitor that, continuing to, again, our journey to zero harm, and the team is doing a really good job around that. High reliability during success. We've also had a reduction in what we call Quantros, which is a system that's being used, Quantros complaints. It also can be accolades too, but mostly is used for incidents. And we have a follow-up process, and we had, for the first time ever, no delinquent reports from the management and or physicians who are responsible for that. So that's a direct testament to our tiered huddle process and to Donna Jones. Thank you, Donna, for your efforts around that, because it's quite remarkable considering the things that we have to respond to.
Thanks, Tom.
Yep. And we earned a platinum level recognition efforts for our ability to continue to educate people about organ, eye, and tissue donor registrations across the state. So I just want to recognize that from HRSA. And also, United UNOS did their virtual survey of our kidney Center of Excellence, Transplantation Center of Excellence, and went very, very well. We don't have our official report yet, but there were no significant findings. So really kudos to the entire transplantation team. We also, if you remember, I think I mentioned that we had our rehab accreditation and rehabilitation officially received that certification, so congratulations to the rehab team. We also got the blue distinction. This is Blue Cross and Blue Shield's distinction for bariatrics, and we applied for a Beacon Award for our trauma ICU. Remember, our MICU has received the Beacon Award, Silver Beacon Award twice, a national award. So we're excited to see how TICU does in this application process. We also got some grants. I just wanted to highlight some of the grants that we received for Ryan White. We also presented in a national conference on our technology for keeping patients safe. So this is a technology that ECMC developed in the IT department for the 15-minute checks that we do. And it's, rather than having a paper process, they actually have an electronic process with patients' pictures on them, so they can make sure that they keep up on those 15-minute checks. So it was very well received. Again, more featuring of ECMC's quality efforts across the nation. Michelle Blackburn received a certification in patient advocacy from the Barrow Institute. So congratulations to Michelle. Patient experience, our scores continue to do well. We are very, very busy right now. And so we're happy to see that our scores are continuing to do well moving forward. Donna Brown and Karen Zemansky presented at a virtual event about elevating patient experiences through cultural transformation. At that same conference or webinar, we had some nurse managers participate in that also. We are continuing to ramp up our diversity and inclusion efforts. Obviously, as we discussed at previous board meetings, this is a significant focus for our organization. And Cindy Bass is doing a great job leading that and has started programming called This Is Home. And the executive team has been through that training. I know John wants to have the board go through similar training, so we will do that at some point. But they're doing a great job of making sure that we look at our strategic pillars across both obviously developing our employees and educating our employees and pushing for equity and getting rid of racism and improving social justice. And we're also looking at many other efforts around patient experience. We actually met with the union, and they're doing a lot of efforts around how we care for our African-American patients in particular. We're looking at workforce development and how we hiring practices, the promotional practices that we do, and how we develop individuals in our organization. So this is a holistic approach, and we'll have more to come regarding our efforts in this regard. Lois Peterson we celebrated, and we had a Lois Peterson Day, and Lois has been a volunteer for 50 years here at ECMC. So she was very excited. We surprised her with a celebration, socially distanced, of course, and it was really a nice day for her and for the ECMC family. We had an individual who was here 128 days, Derek Summers, and we had a celebration for Derek as he left ECMC. Just some other efforts we're doing to make sure we keep the mental health of our employees and mindfulness. We are doing some outdoor yoga for our employees. We also have participating in the Bills fan box to benefit ECMC, obviously highlighting Black Lives Matter and working with the Bills to benefit ECMC with these packets. ECMC Golf Tournament was a great success. Again, we didn't have a lunch or a dinner afterwards, but we had a great day of golf. It was sold out. There was actually a waiting list, and we raised a significant amount of dollars. So I'll go to the next slide just to kind of show you all the foundation initiatives. They've been doing a great job during this time of not being able to have events, raising money. And we just recently closed our Tim Hortons Smile Cookie campaign, which raised $125,000, which is incredible considering the less traffic that's going through some of those businesses. But again, golf tournament did well, as well as some of the other events that you can see here. And this is cash in kind from the community and donations for COVID since the COVID pandemic started. So thank you to everyone. We put the ECMC letters back on the building finally. So we got those up. Those will be illuminated probably in about a week as they put the electrical in now. And it's nice to have the letters back on the building, and went off without a hitch. A couple other important operational things to point out. We started a cohorting initiative. I think I've mentioned this before. We discussed this in the executive committee. This was a significant effort to cohort our patients by service. It's very difficult to do it at an organization like ours, which has 78% of the admissions come through the emergency department. And Dr. Cloud and Dr. Murray and Karen and others have really done an excellent job so that physicians are not running between 6 floors, and we're really trying to make sure that teams are all consistent for patients. So this should have a myriad of benefits, from patient experience benefits to throughput benefit to quality of care benefit, not in that order of importance, obviously. But I just want to, I'm just covering it briefly, but it really is an impressive effort, and one that many hospitals across the country struggle with. We have had success with, so just kudos to the team for that. We also removed the ED ramp So that's underway, and as you know, there'll be kind of a driveway in front, so that's an important piece of our new trauma and emergency department. We supported the governor's rapid testing sites very well with that. Thank you to Peter and thank you to Jim Turner and others for their efforts there. We hired a new administrator at Terrace View. Michelle will be starting, last name's Kraus, right? Correct? Is that right, Andy?
Yes, correct.
Michelle Kraus is going to be starting in October. We're very excited for her to be coming. She's coming to us from Fox Run. Pastor Gardy Davis, as you may know, will be taking over as Chief Trauma Chaplain. We're very excited about Pastor Gardy Davis taking over pastoral care for UCMC. August statistics, and then John will do a brief financial report on August, but it's good to see some green on our financial report. We're doing very, very well this month. We have very high volumes. I think our discharges right now are 12% higher month to month in September. So we're continuing to see more patients. If you look at that inpatient surgery number down below, we are seeing more total knees be converted to outpatients, which is a good thing for us from a margin perspective, because we receive a bundled payment from the payers on that. So, not necessarily bad that we're seeing reduction in inpatient because it's being converted to efforts that we're pushing, but continuing to watch that number. And just overall length of stay being down with a higher case mix index and more medical patients is another thing that's very, very positive. So just kudos to the team on that. So I think I got to turn this back over to you, John. Let me just do that and let you cover the August 2020 financial performance.
Okay, thanks, Tom. I think we are now officially technologically savvy, or at least close to it. So as Tom mentioned, you saw a bit more green on that last slide. I think it's important to note, just quickly back on this slide, that as I was referring to earlier, we are seeing an uptick in emergency room visits as well, as well as our discharges. Those admissions from the emergency department during the month of August, it's really the second month in a row that we're seeing a significant change from our budget, but also from last year. And that change is really indicative of obviously just the sheer volume that we've had within the ED, but the types of cases that we're seeing as well. We also, as I mentioned earlier, are managing the length of stay quite well. We're at budget during the month of August, but even into September, we're seeing an average length of stay in the 6.4, 6.5 range. So we're hitting the target on that front as well. And so what that translated to for the month of August is a little less revenue than what we had expected, just given the inpatient surgeries that were down. So inpatient surgeries are down; they're shifting to the outpatient setting, quite simply, and we get paid less on an outpatient case than we do on an inpatient case. But also we're seeing COVID impacts really continue on the operating expense side. Those costs are continuing into August, and we expect certain costs to continue. This month we actually saw some costs that were larger than usual, and in some cases will normalize after this month, but we're really out of period type costs. And those were costs to increase our supplies to the 90-day standards, costs to fund our healthcare claims, which had increased significantly for our employees, but also a certain cost related to other benefits from the furloughs and voluntary work that had been done several months ago, especially around, and really what's happening now is we're seeing the unemployment costs increase temporarily. So what that's resulted in is about a $4.6 million operating loss before any CARES Act funding relief. That CARES Act funding relief that we recognized this month was about 2.7, so that nets down to about 1.9 million. And all the costs that I had articulated as out of period, roughly approximate a little over $2 million of additional costs. So when you shift that and add that to what we had going into the month, that translates to a dollar amount of about $80.4 million of operating loss for the year through August. And then CARES Act funding relief of about $41.4 million that's been recognized. And as we've said before, we're continuing to recognize funding relief as we meet terms and conditions related to those funds and as we continue to incur expenses. In the projection that I showed you earlier, you will remember that the total that we've been awarded thus far is roughly $51.5 million. So that brings us down to an income loss position for the year of about $38.9 million. And as I did talk about COVID costs and want to make sure we keep you up to date with the snapshot of what the impacts are. This is, again, a snapshot, so it's ever changing as we continue to refine and incur costs, as well as track the revenue loss that we continue to see. Through August 31st, this totals about $72.7 million of total cost related to the pandemic when you add in lost revenue and our additional costs throughout the period. Of course, as we continue to monitor things around that are happening around the country, but also here within our four walls, the federal CARES Act relief update is essentially that at this point in time, no further action has been taken on the undistributed funds that we've referenced in the past. Those funds still exist. There's roughly $56 billion of undistributed but approved CARES Act funds from previous Relief Act and previous distribution awards. But then again, also what's happening is we're looking at the upcoming potential Relief Act legislation that could come at some point in time in the future, but obviously now is really taking it's really getting mixed in with all of the other focus areas of the federal government that you've all been reading about. As we sit back, we monitor cash. Darby referenced it during the budget discussion, but this is a focus of ours, and it's really key to how we manage through the rest of this year and into next year. We have about 111 days cash on hand, and that's designated assets as well as our typical operating cash. Of course, that's been bolstered, as we've talked about in the past, by our Medicare loan as well as the PPP loan. That Medicare loan and PPP loan at this point, we still have set to be paid back in over the next year or so. So that's why you'll see, and you heard Darby reference, a reduction in cash into next year's ending balance sheet in the budget, and that's really driven in part due to these paybacks. The last thing that I will mention as part of my finance report for the month of August is that we have been monitoring, as part of the COVID-related impact process, a potential issue as it relates to how the valuation timing of the New York State pension plan will impact ECMC. And because that pension plan is valued as of March 31st, given the market dynamics that occurred in March, the interest rate dynamics, both of which drive pension expense for all of the participants in the New York State pension plan, not only us, we do expect there will be an unfavorable impact in our current year pension expense. We're tracking that somewhere in the $30+ million range for just paper expense. Doesn't impact our cash outflow at this point in time. But just wanted to keep the board in tune with that, and we'll have more updates on that as we get further along into probably next month once we get further information. So I'll pause there for questions, but John, that completes my report.
Thank you, John. Tom, anything else on your president's report?
No, nothing else unless there's any questions.
Any questions for either John and or Tom? Okay, I would be happy to take have a motion to go into executive session.
John, just before we do that, I just want to, we're going to obviously take the public line off. If for some reason we have technical difficulties about bringing it back on, just want to mention that we're going to be adjourning the meeting with no further action. So we just make that.
Yep, that's what I was going to get to. So is there a motion to go into executive session, please?
So moved.
Yes,
This is
I'll make that.
Sharon.
Oh, sorry, Sharon.
That's okay,
Thank you.
Jen.
Is there a second?
We'll share.
All in favor?
Aye.
Aye.
Okay.
Aye.
Aye.
Okay, we're out of executive session. Are we back online?
One
Jen,
second.
Might be.
Give him 1 second.
You are now back online.
Thanks, Adrian.
Thank you. Thank you. So we're back online in the public portion of our meeting. Do we have anything new or of new and or old business to discuss?
Hi, this is Jen. I just have one. I know I want to say thanks to the executive leadership team and to John for putting together such a great presentation on what is generally not good news, but we will get through it. And I guess in the spirit of that, I noticed in looking at my calendar for the upcoming weekend, I know we all have so many things planned, but one of the things that used to be on there was the gala. And so I just wanted to bring everybody's attention to the fact that I think October 1st, we will start a new drive to raise some money. I know it's a difficult time for everybody financially, but every little bit helps. I think that you'll be getting, touches from Sue and her wonderful foundation, and I would just encourage everybody, since you don't have to spend the money on the tuxedo or the new dress this year, maybe you could put that in your envelope and get it along to Sue with the board's gratitude. So that was my only message to encourage to give, and it's nice to see everybody.
Thank you, Jen. I'm sure you'll be out front of the convention center in your full-length gown, waiting for people to show up with their envelopes.
Well, that was almost me in the conference room today. So thank you, Tom, for the heads up.
Thank you for those comments. Very well said. Let the record show that this meeting was conducted while I was crossing the George Washington Bridge down the West Side Highway and now on the 59th Street Bridge. So thank you, and have survived. So thank you all very much. Tom, thanks for your help. Jeffra, as always, unless there's anything else, we are adjourned. Thanks, everybody.
Thank you, everybody. Thank you.
Take care. Have a good night, everyone.
Bye now.